Was having a great pregnancy, felt great, was excited to find out if we were having a boy or a girl, and we were in the room having the normal ultrasound, and you could tell the ultrasound tech something wasn't right.
She wasn't able to see the baby's face properly, and so she asked me to come back the next week, and I remember my heart starting to beat very quickly.
All I heard was there was something wrong with our baby, and it was a really scary and overwhelming feeling.
I think so many people feel like, why me? I'm alone, why did this happen? And sometimes it's not because of any reason, it's just a fluke thing of nature. Immediately after delivering him, they took him away to clean him up and weigh him and do all the procedures for a new birth. And they pulled my husband aside and said, we noticed that he has a cleft lip.
And he started to speak very quickly about seeing doctors and surgeries, and he said that surgery is very good these days, but there could be other complications. I was worried he would get teased at school. I was worried about what he would eventually look like, if he would feel like he had a normal life.
Within minutes, they were giving us phone numbers of people to contact, and everything would be okay. They said you need to make an appointment, as soon as possible, get him down, have him be seen by the team down at Children's Hospital, and you'll be in great hands.
So it was basically looking at the internet to start off with, and then we had our first meeting with the doctor.
We came to Children's and met with the doctor and the cleft team, and met with them to go over specifics of when the surgeries would be, how the feeding would go, what the options are.
We learned, what types of bottles we would need. We got information on how we could get those bottles. We had some level of comfort that we would be able to meet with somebody within the first 1 or 2 days that the baby was born to help sit with us and help us learn how to use the bottles once the baby had arrived.
So many different types of clefts. It's not a cookie cutter kind of diagnosis. Just knowing that there's more than one bottle that could work for a child is a huge help.
We specifically brought our mothers with us to learn how to feed with the Haberman bottle. So we knew that our family members would be able to help us from the get-go.
Everybody seemed to know what to do. They all had their own different expertise in different facets.
We found out from there about the Foundation for Faces of Children, which, from that point until current day has been a great support for us.
I was more educated on the situation. I wasn't as worried, and once I was familiar with the approach that would be done by Children's Hospital in Boston, I was even less worried.
So when my son was born, there was nobody on the maternity ward who knew how to use the Haberman bottle, which is what we had with us. And I think for us, it felt very different once we actually had the baby to sort of remember all the things we had been told for how to use it.
I was emailing at 3 a.m., Ella's not taking her bottle, and what am I supposed to do? And there's other parents that were actually helpful as well at 3:30 in the morning saying, well, this is what I did, this is what you need to try.
Feeding could last up to an hour, and if it was a good feeding, he would have, starting at 2 cc's and working his way up.
We made an appointment, we came in, and we were able to, have a lesson, I guess, in how to use it, and realize that we had been doing it wrong, of course.
Trying to try a few different techniques and find out what he liked and what worked.
There was definitely many nights, in the middle of the night, I'd be sitting in Nora's room and just feeling overwhelmed about, am I doing this the right way? It would take so long. It was definitely something that took, half an hour to feed her a couple ounces.
It's a little bit awkward, the way you have to hold the baby and the way you have to hold your hand in the bottle. It can be very awkward.
And then after a week or two, I started doing some feeding as well. It was tough just because of the placement of the nipple and how to get it in there. But after a couple of times, it was pretty easy.
Eventually he was taking an ounce, and then it was 2 ounces and 3 ounces, and before we knew it, he was having full bottles and full belly, and got easier and easier.
I would say it probably took about 2 weeks to get comfortable with it. But once you are comfortable with it, it feels very natural.
As each surgery, came, that was always a struggle as well, because we had just gotten the feeding down pat, and then the next thing we had another surgery.
I remember one specific feeding issue. It was after her Latham appliance was put in the first night in the hospital, and that was extremely overwhelming because that was the first surgery that Ella had. And all night we were up with her, going through different ways to approach feeding her, and we used syringes and little droplets and stuff, and the nurses were just very knowledgeable.
After each surgery, the feeding does become different, but it's just like in the beginning. It just takes a little bit of time, and the baby wants to eat, and you want to feed them, so it works out pretty good.
A big lesson I learned was that you are the person who has to advocate for your child. It's so important in the hospitals when you're going through the surgeries to be aware of what's going on, when they're scheduled to get more pain medication, what schedule you should be expecting to be on.
As the journey goes on, the cleft just kind of doesn't seem so, not to say it's not important, but it's not your focus. Our focus now is swim lessons and preschool and soccer on the weekends and endless activities, and
ask as many questions as possible. It's the only way everything that you're feeling is going to get answered.
I think the most important thing is to arm yourself with as much information as possible. Doing research helped a lot, talking to doctors helped a lot, but talking to parents probably helped the most.
if I had any advice for clinicians when dealing with families that receive a cleft diagnosis, I would suggest providing them with as much information as you can.
One of the things that I was most worried about was how were people going to react to my baby? How would they react to seeing the cleft? I was very anxious about that, and I was surprised to see that once he was born, I didn't care at all. That I saw he was so beautiful that I didn't care.
Cleft does not define a child. It becomes a very, very small part of who they are.
These unique differences makes them who they are, and that they're able to connect with other people in different ways, and I think that they're able to turn something that could be a negative in their life into something positive.
Stay patient with yourself, with your child, with your spouse, with the situation, to take one day at a time, to not look too far into the future, to really enjoy every moment with your child.
For me, the whole experience was like that. For me, the whole experience has been better than I thought it would be. In many ways, it has felt like an empowering experience to go through. I think it's made me a more sympathetic person to other people who are going through a lot of different things. I hope that it makes him a more sympathetic person when he grows up.
Your child is more resilient than you think they are. I think it's been more difficult emotionally on my husband and I and my family versus her. She doesn't know any better, but this has just been her life, and she's the happiest child ever. She's been through a lot, but she's so happy.
He has a beautiful smile. He has very full lips, which I always say that his lips rival Angelina Jolie's, and he's just beautiful.
Those first 9 months were crazy, they were stressful, they were overwhelming. They were also, amazing and wonderful.
And he's 15 years old now and happy as can be, and everyone that looks at him says they can't believe he ever had a cleft lip, because you can't even tell.